So welcome you all to today's session. Is voice is audible? PPT is visible? Is it clear from my side? Please do text so that I can go on. Is voice is audible? Is it clear? Yes, fine. Thank you. So welcome you all again. Today's session, understanding these female complaints with homeopathic remedies and their indications. So you can read this. This is what generally in every my session we focus on this thing, which is the constitutional prescription is the ultimate for success, not the therapeutics or not some clinical indications of some clinical experience from different masters. Until and unless we get the indication of the remedy that has to be used. So in today's session as well, we are going to discuss a lot of remedies under different rubrics, under different conditions. But ultimately, the goal is to prescribe based on the totality of symptoms and the constitutional approach. So a brief introduction to the premenstrual syndrome with homeopathic remedies. So whenever a patient complains of having premenstrual syndrome or any remedies, so there are some general rubrics from different repertories we have picked. So the first rubric of today's session, that is generals, menses, before. So you can see the 3-mark remedies here: bovista, calcarea pos, copper, lachesis, lycopodium, nitramur, pulsatilla, rustox, sepia, sulfur, veratrum, and zincum. So this is what we need to understand here. See, we have enough remedies to prescribe on just one single symptom or one single rubric. But to prescribe bovista, we need to have some complaints of this bovista-like symptoms, of skin eruptions, or urticaria-like excitement in the past. There is one beautiful clinical indication for bovista to prescribe urticaria in the past, especially after excitement, and any sharp instruments, if they touch it or if they play with it, the marks of the instrument will be on the skin. So calcarea cup, we all know, very obese. At the same time, they can be thin, craves for eggs, fears, a lot of fears you can see in calcarea cup. So this constitutional approach, we need to have a look at it in everything. Calcarea was very long, thin, and long fingers, long legs, with calcarea-like symptoms and phosphorus-like affection, extroverted, craves for ice creams, craves for cool drinks. And calcarea pos is one of the wonderful remedy. If you get a case who have aversion to eat rice, single remedy in child cases. And one of the clinical tip I can tell you about this remedy is, especially in children's, in today's generation, they have their food by seeing this TV, by seeing the phone, by seeing any toys or anything. So that can be one of the clinical confirmatory to prescribe calcarea. So like that, we goes on discussing Cooper with lot of spasms, constrictions, CC, lachesis, we all know. So snake remedy, jealous, suspicious, tight clothing aggravation. So these you need to get in each and every rubrics, each and every remedy before prescribing. Try to confirm it with some clinical confirmatory symptoms that will be in your metramure. Nitramure, thin, emaciated, warts on the palms and hands, cannot urinate when the presence of others, craves for salt. So these are some clinical confirmatories. These we have discussed in our previous sessions as well. So coming to the same rubric under 2-mark remedies, ammonium carb, beretta carb, carboH, hyoscyamus, you can see, kali carb, creose, magnum, merc, nitrum phos, phosphoric acid, phosphorus, platina, and verbascum. So here we are discussing about female. I'll give you a gist of verbascum here. So verbascum is a wonderful remedy for habitual abortions. For habitual abortions, you can think of verbascum. In complete repertory, there is one rubric like habitual abortions. You can think of to about this. You can think of verbascum there. It is wonderful remedy there. And ammonium carb is also a beautiful remedy, for it is also one of the women's remedy, especially if you find these two things. The one is if patient is obese and having past history of heart complaints, you can think of this remedy. There is one rubric from synthesis, generalities, obesity, especially in women's, single remedy ammonium carb with heart complaints. If you get heart complaints, obese lady, and you can think of this remedy. that is ammonium carb. So creates a lot of offensiveness. You can think of this remedy. Lot of offensive with nuclear, with lot of pains in dysmenorrhea. There you can see a lot of offensiveness complaints of creos. You can match it there. So coming to the next rubric, general faintness, fainting, menses before. So menses before, if a patient complains of this fainting like symptoms, the remedies are lycopodium, murex, nux moscata, sepia, and thuja. So murex comes very close to sepia, the bearing down sensation. You have this sensation of bearing down. The three remedies, one is murex, lilium tick, and sepia. And lilium tick mind state comes very, very close to arsenical. Very, very fastidious, very, very anxious for health. But in arsenic and lilium tick, the two quite difference you can think of is in lilium tick, there is a lot of sexuality. But at the same time, the sexuality and they go, if they perform sex, they feel that there is a sin. So that could be the state of lilium tick. But in arsenic, that sexuality is not that much present. And both have the same symptoms of fastidious, cleanliness. Everything comes very close to arsenic in lilium tick. Murex, the bearing down sensation, acts on uterine organs of pathology like sepia. And sepia is a wonderful remedy for abortions, especially in the 5th to 7th months. In between 5th, 6th, 7th months, we can think of sepia there. And I will tell you one clinical tip for sepia is if you find a case of a mother and the fetal heartbeat is not present, fetal heartbeat is not present, you can think of sepia one in single dose, or you can repeat it every 2 hourly to get the fetal heartbeat of oxygen. And this was given by Emil Taylor in his book, in her book, sorry. So that is sepia there. And sepia clinical confirmatory, they are aversion for cold milk, especially cold milk causes diarrhea for sepia. That is one of the confirmatory there to prescribe sepia. A lot of indifference we know there. Coming to the next rubric, generalities, weakness, a lot of weakness, menses before. Belladonna, Cocculus, Macab, and Nitromure. So Macab is orphanage of materiamedica, orphanage of remedy for materiamedica. They are the peacemakers in homeopathic materiamedica. So if you find the symptom of these peacemakers, everything you can think of giving Macab there. And Macab babies, there are a lot of offensiveness, especially in the stool with greenish offensive stools, comes very close to room babies. Belladonna, lot of suddenness. Coming to the next rubric, chest pain, mammy, menses before. Again, three remedies. 3-mark remedies, calcarea, conium, and 2-mark remedies is laccananum. I will tell you here, laccananum is a wonderful remedy for wandering like, shifting like pains, comes very close to pulsatilla, kali sulf, right? And it has a beautiful action to dry up the milk in the mothers. Of a pregnant woman, to dry up the milk, you can think of laccananum. It is one of the clinical confirmatory symptoms, and I will tell you one of the beautiful indication of laccananum, which I learned from the book of great master Professor George Vitokals, and I have seen on the case of this laccananum. Sir says that to prescribe laccananum, one of the key confirmatory is laccananum patients cannot able to see the snakes, especially in the television. Suppose if a patient of laccananum scrolling some reels, suddenly if they get a vision of snakes, immediately they throw up the phone. Immediately they shift the channel to other. So such a fear of snakes, even in the vision, it's a wonderful remedy. If you get that clinical confirmatory from the patient with matching to laccananum symptoms, it works wonders. It works wonders. And laccananum menses before mammae pain. A lot of mammae pain is related with this laccananum. Conium, heart tumors like philandrium, conium, philandrium, phytoleca. These are some remedies for this mammae, breast mammae actions. Chest, fullness, menses before. Sulfur. Sulfur is a huge remedy, polycrust. Chest swelling, mammae, menses before. Calcarea, laccananum, and tuberculinum as well. Right? So palpitations of heart, menses before. The remedy is spongia. And spongia is a beautiful remedy in heart complaints, especially of cough, which is like sawdust cough. Like sawdust cough, you can think of spongia there. And with heart complaints. Coming to the next, vertigo, menses before. Calcarea pause, colophyllum, like rheumatism of small joints, fingertip joints, it comes very close to actia spicae. Conium, lachesis, pulsatilla, veratrum, and zinc come there. Single remedy other here, head pain, menses before, creos, right? And two mark remedies are aconite, ammonium carb, asaram. So asaram is a very oversensitive, very oversensitive patient of asaram. Even the slightest paper sound, the turning of the paper to other page, they got lot of oversensitiveness, lot of irritability. And this asaram oversensitivity comes very close to pteridine there. Pteridine is also very oversensitive to noise. Very oversensitive to noise. And I'll tell you one beautiful clinical tip of pteridine for you. In cases of ADHD or autism, where patient have this theme of spiders, suspicious, restless, right, and dancing desires like spider theme, and patient craves for bananas. Pteridine is wonderful remedy for craving for bananas, especially in children's cases with themes of spiders there. It works wonders. Head pain, menses before, amel when flow begins, lachesis and millefolium. So both are anti-hemorrhagic remedies. Yeah. Stomach, nausea, menses before. Hyozymus, lot of sexuality. Ipecac, whitish tongue, nausea feels better. Lycopodium, nitromure, nicolum, and pulsatilla. And nicolum is a wonderful remedy, comes very close to naxomica, with lot of bilious-like symptoms, bilious headaches, comes very close to naxomica. Rectal constipation, menses before. Kalikab, lachesis, and silicea. Kalikab, three things: backache, weakness, back sweating, never well since pneumonia. And quarrelsome in between family members is one of the key confirmatory to prescribe Kalikab. Sorry. A Fatak single remedy. Rectum, diarrhea, menses before. Ammonium carb, Bovista is a high grade remedy. Cinnabaris, lachesis, nitrum sulfan, extremities perspiration at the foot, menses before and during, calcareous carb there. Extremities swelling, foot, menses before, single remedy lycopodium. Coming to the state of mind here. So how the physical sphere, how the pathology is affecting the mind is most important. Mind, anxiety, menses before, cocculus, graphitis, ignitia, nitromure, nitric acid, noxomica, stannum met, and sulfur. Graphitis is left-sided calcarea carb. If you get a patient who is calcarea carb, who is showing symptoms of calcarea carb, which is of left-sided, think of graphitis. Think of graphitis. Cocculus, we all know, night watching. Mind excitability, excitable menses before. Three remedies again: creos, lyco, and noxomica. Mind fear, menses before. Aconite, calcarea, and sulfur. 12 is hysterical. Hysterical menses before. Hyozymus, moscus, and platinum. And moscus is a wonderful remedy, especially of these hysteria-like conditions. Very hysterical. It is above valeriana, it is above ignitia. Very hysterical. They easily faint because of this. Moscus is come from the smell of musk. So easily fainting you can see in this remedy. That is key confirmatory. And in anger, one thing from Kent repertory, single rubric I remember. Moscas, in anger, there's so much of abusive until their lips turn into bluish. That is the key confirmatory of Moscas there. Irritability, menses before, causticum, chamomilla, lyco, nitromure, noxomica, and sepia. Very restless, menses before, creos, noxomica, pulsatilla, and sulfur. Sadness or mental depression, that is melancholic like state, especially menses before. Nitromure is a high grade remedy. Pulsatilla is also high grade. Stannum, right? And stannum is a beautiful remedy for respiratory action. Beautiful remedy. And patient cannot able to speak, cannot able to talk. That much of continuous cough you can see in the stannum with lot of weakness in the chest. It's a key confirmatory to prescribe stannum in acute cough cases. And metallic like taste is stannum. Metallic like state is stannum. And especially ulcerations in the ear ring hole, as I discussed many times when this remedy comes, because I did one case and it was clearly mentioned in Boric as well, that ear ring holes ulceration, stannum work wonders along with medorin. Very sensitive, menses before, noxomica and sepia. Weeping, tearful mood, menses before, cactus with lot of constriction, heart complaints, lyco, phosphorus, pulsatilla, and zincomet. So coming to the next, that is dysmenorrhea with homeopathy. Dysmenorrhea, pain extending to thighs, xanthosylum and simsifibula. So simsifibula is a beautiful remedy if you get a case where you are thinking of having ignitia, staph, or nitromure, and these three states are you are seeing in a patient. You can think of the remedy simsifibula works wonders because it has hysteria like ignitia, disappointment of love, introverted like nitromure, very, very oversensitive like staph. It's a combination of these three beautiful remedies of simsifibula. And you need to have the confirmatory of simsifibula there. And simsifibula is a wonderful remedy. We can think in cases to prevent stillbirths in 1M potencies. In 1M potencies. Xanthosylum, we are going to discuss xanthosylum very, very beautifully in the coming slides. Its mind pattern, fear patterns, and dream patterns. And xanthosylum is a wonderful remedy when almost all your dysmenorrhea remedies fails to act. You can think of xanthosylum. Dysmenorrhea, cramps in calf, right? Colosins. For sciatica cases, we can think of this remedy. When the patient complains of sciatica pain and say, you ask the patient to lift the leg like this and fold it like this. If patient feels better, it's the remedy of colossus. Dysmenorrhea, pain extending to feet, colophyllum again. As I said, rheumatism of small joints comes very close to Actia spicata. And colophyllum is a female, like it was written like that, many people say, but there is no specific remedy for females, there is no specific remedy for males. In homeopathy, nothing like that. If CPI is indicated to male, we need to give. If colophyllum indicated to male, we need to give. It's nothing like that. But in comparatively, they have written like colophyllum for small joints, especially of female. For males, it is active spine. Dysmenorrhea extending from back to thighs. So almost all back pains, back weakness, back sweating, kalika, sorry. Dysmenorrhea extending diagonally, like murex diagonally, as I said. Dysmenorrhea drawing to the bones like tansitum vulgare. Dysmenorrhea extending to the throat. See, dysmenorrhea extending to the throat like symptoms. See, that is what lachesis and gelsing mean. We generally think, see, lachesis having this throat constriction like feeling, even tight clothing aggravation. That's the symptom here. The dysmenorrhea pain is extending to the throat, lachesis and gelsing. In to differentiate these two remedies, lachesis suspicious, jealous, tight clothing aggravation, like very beautiful ladies, lachesis. They participate in Miss World, some beauty contest. Gels, lot of dullness, drowniness. You can think of gels in that. And tansitum is a beautiful remedy for abortion, especially in early months. Early months of abortion, tansitum you can think. Coming to the next remedy, there is belladonna. Belladonna is a top remedy in dysmenorrhea. It's a top remedy. Menses, during menses, they feel a lot of hot aggravation lying down, lot of violent spasms with suddenness. And this symptom you see, uterine prolapse, standing amyle, erectile posture amyle is belladonna. And belladonna, to confirm the patient of belladonna, is one of the key confirmatory which I learned from master, that is belladonna craves for lemonites. They especially craves for lemonites and lemon juice is a key confirmatory. If you get it with belladonna-like symptoms, belladonna works wonders. And other thing I will tell you, like M.L. Segal book, if you are heard of M.L. Segal, that is Rediscovery of Homeopathy, he has written some books of between 15 like 13 volumes. In that he writes like unconscious interrupting with screaming. That one rubric will tell you the whole core of belladonna. What is this rubric? I tell you. See, unconscious interrupting with screaming. So belladonna patients will tell you. See, belladonna patient has come for your consultation on 2024 of this September, right? This September of today's date. I think today's date was 12th, like 12th September 2024. The patient has come and you have given belladonna, and he vanished away. Again, 2025 of next year of September 12th of 25 he came. That is what the rubric, because belladonna patients are unconscious, but they come into conscious when they have these sufferings. When the sufferings are there, they come into conscious and come to you. So, doctor, I'm suffering with so and so complaint. Please do somewhere. That is what unconscious interrupted with lot of screaming. Single remedy belladonna. Coming into dull camera, during menses, they start skin eruptions, boils around genitals, cold aggravation, and herpes as well. So this is the remedy of dull camera. There. We all know dull camera. I'll tell you one beautiful rubric of dull camera from Patak. Ice factories. Ice factory working single remedy dull camera. So this is what we need to have a just in case taking of occupation. Why? Because in ice factories, patient will be under there for working for 12 hours to 13 hours in a shift or 6 hours in a shift. And in that, the temperature is at the -2, -1, sometimes going to -5 due to all the preservatives, etc. Then they come into the state of normal temperature to the home. For 1 year, it is no fine, no problem. But after that, the complaints start. But patients say, doctor, don't know why it all started suddenly. Okay, where you are working? Doctor, I am working in milk factory. Okay. From how many years? From 1 year. Okay, chilo, dull camera. Because from ice factories, because of the change in the temperature, the vitality is low after from 1 year. The derangement of vital force is done there. So that time dull camera works wonder. That is the indication there. And is a beautiful remedy for rheumatic complaints. Comes very close to rustox like modalities in acutes. But rustox is a red triangular tip of tongue, dull camera and whitish clean tongue. And warts, it's a beautiful remedy for warts in the hands and palms. It has cured many cases of dull camera. Next, Raminus California. This is very similar to Macros. Very similar. Right? Dysmenorrhea with muscular pain, lot of soreness, which is from myalgic origin. It has eczema with lot of restlessness. Eczema, restlessness. If you get this symptom with Macros like symptoms, you can think of this. Is it going well? Is it going well? Please text it. Voice is clear. It is going well from my side, or am I speed? How it is going on? Please do text. If you text first, so that I can continue well. Yes. Thank you. Naxomica. It's a wonderful irritable remedy, jealous remedy. Recently, we done a beautiful understanding of Naxomica deeper patterns with almost 25 single rubrics of Naxomica, which is uploaded in our YouTube, the Homoeopathic Center. You can go and watch it there. Now here, Naxomica, fainting with menstrual issues, chill, want to be covered, anger, aggravation with metrorrhagia. With metrorrhagia, there is a lot of anger. Fainting with menstrual issues is Naxomica. Epis. Dysmenorrhea with scanty discharge of slimy blood with ovarian pains. Ovarian cyst. Right-sided ovarian cyst cases, Epis works on. I tell you one thing. Tell me the remedy which has the same action like Epis, burning, pain, stinging, but the ovarian cyst is left-sided. What is the remedy? Do it first. What is the remedy? Epis is right-sided, but a left-sided ovarian cyst with same like Epis-like symptoms. What is the remedy? Over toaster. Okay. Still, it's a snake remedy. It's a snake remedy. The remedy is Vipera. The remedy is Vipera. Vipera. Yes. Yeah. Someone has to elapse. Yes. I'll tell you more. Vipera is a wonderful remedy. If you refer N.M. Chaudhary, N.M. Chaudhary Materiamedica, he mentions it. See, different Materiamedicas have different actions, different understanding. Even if you refer Farrington, he given that. He has mentioned for. Coming to Veratrum, very cold sweat with forehead with lot of pains. Sore jelly, sore mangoes, desire is Veratrum. It's how beautiful. Cold sweating like carbohydrates, like campfire, with forehead like pains, especially in dysmenorrhea, with the craves for sour jellies and sour mangoes. Right? That is the clinical indication of Veracum. And I'll tell you one beautiful clinical tip. Understand Veracum. They want to have this social position, a lot of show off. For example, if a patient, if a mother says to a child, doctor, na, my child, whenever we go for shopping, na, he don't buy one single pair of shoes. He buy three to four pair of shoes. If you go for any watch shop, na, he'll buy different brands, like one brand of one watch, another brand of one watch. He don't buy single anytime. If you go, he buy multiples, 2 and 3. Extravagant in purchases, show off, veratrum. That is the clinical indication that you need to observe in any patient. And veratrum works wonders. Veratrum works wonders. Crotalus, it's a beautiful remedy, an anti-hemorrhagic remedy. And as I said, it's almost all, it's a beautiful remedy, especially in dengue cases where platelets have been too low. We can think of Crotalus heredus repeatedly, every hourly, for 24 hours to 48 hours, the dengue platelet will come up. I did at least 5 to 6 cases of Crotalus heredus with dengue. And generally, as it comes, so many people are asking for to post some of your cases in the groups. I get a lot of text, but why I'm not going to post it is like we are planning to have an ebook which is under under the writing. We are writing the ebooks. In that we have posted a lot of cases like chronic psoriasis, coma cases, this dengue platelets cases, and chronic vitiligo cases with case taking pattern and the before after pics, how I took the rubric, why I have took it. So I'm preparing one ebook for you all, which is going to be coming in very few months. So that's why I don't post my cases there. But I can assure you, all of my cases are well documented with almost all the testimonies. We are coming up with few ebooks to everyone because there are many materiamedicas, because there are many organ books, there are many repertory books, but there is no book which is very clinically verified. There are many books which are in stalwarts. Now we need to pick up that stalwarts and we need to move forward with the cases with explanation. So Crotalus, dysmenorrhea, pain in hypogastrium, down the thighs you can see, a lot of dark black clots you can see in this remedy, uterus dropout like sensation, and in uterine cancers, Crotalus herbis works wonders. Castoreum, it's a very historical remedy, very historical remedy. Dysmenorrhea with painful tympanitis with gases, like with eructation. Cancer of tongue is a wonderful remedy. Comes very close to calicinatum. Comes very close to calicinatum. Another remedy for cancer of tongue is gallium apparet. Gallium apparet. It works wonders. And it is ignitia-like and analogous to moscus. Dysmenorrhea with constant yawning. Tell me other wonderful remedy where patient constantly yawns. And that is one of the indication to prescribe one beautiful remedy. Do it first. Constant yawning. If you have an idea, you can text it in the chat box. What could be the remedy there? Sina, okay, fine. Next. The remedy is amylonitrosome. Amylonitrosome. Constant anim. And it is a beautiful remedy for cancerous pains. If you read it from Allen's. Pain is amyl by rubbing and pressure. Naphthalene. Wow, what a beautiful remedy is naphthalene. Especially in sciatica with lot of numbness. It is undoubtedly a wonderful remedy for sciatica pains with numbness. Dysmenorrhea, sciatica with weight and fullness in the pelvis. And fullness in the pelvis, we can think of this remedy. Tancitum, we already discussed. Dysmenorrhea with half dead, half live feeling all over. So there is a lot of weakness. I will tell you Tancitum why it has written half dead, half live feeling all over, right? This is wonderfully comes very close to China, very close to Carbovage. Why I am saying this line is if you open from Boric or Fatak, I think from both of the mechanicas, it has written in worse in debilitating diseases, especially of women's from Fatak. So in debilitating state of any diseases, China is not working, Carbovage is not working, or some other XYZ drug not working, you can think of this remedy, Tancitum vulgaris. And in dysmenorrhea, with a lot of debilitating, with a lot of weakness, you can think of this remedy, Tancitum. Try to refer from Fatak or Bori. Both have written. Next, Senecio oris. Wonderful therapeutic remedy. Many of you, me in my early days, if patient complains of amenorrhea, chalo Senecio de do. But it never helped. Frankly speaking, it never helped. until and unless we get the indication of amenorrhea in young girls with sleeplessness, with backaches. With backaches. Forgot to write here. Amenorrhea, young girls, that is functional amenorrhea with lot of sleeplessness, with backache symptoms. If it is there, Senisho works. If not, no. If not, no. But if that indication is there, it will help for sure. It will help for sure. Dysmenorrhea with urinary disturbances, with low HB count, we can think of senescence. Tell me the other remedy for amenorrhea, especially of this functional amenorrhea in young girls. It is written in some remedy. You can text it or you can have a chat there. What remedy it could be? Yes, Polygonum pinaculatum. One doctor has said that's right answer. The answer is Polygonum pinaculatum. Next remedy, Nux mostata. Historical, a lot of dysmenorrhea, losing flesh, especially in the breasts, and faints easily. Dry mouth with lot of thirstlessness and lot of cannabis-like state of indications you can see in this remedy, Nux mostata. And I will tell you, Nux mostata is a wonderful remedy for rheumatism of shoulders, especially of right-sided when your ferrum is failed to act. When your ferrum is failed to act. Ferrum is right-sided, Nux vomica is also right-sided. Sorry, left-sided, left-sided, left-sided. Right is sanguinaria canadensis. Right is sanguinaria canadensis. And this remedy comes very close, like bryonia-like symptoms you can see in Nux mostata as well. Next, verbascum, recurrent abortion. This is what is it. Recurrent abortions, dysmenorrhea with lot of flatulence, dysmenorrhea flow amel. We can think of this remedy, verbascum. Right. Next, gossypium, sensation as if menses are going to start, dysmenorrhea with lot of nausea. So gossypium to view to prescribe, we need to have a lot of nausea, lot of vomiting like feeling, like it can, like it can. Dreams of dead people during menses. Colonsonia, dysmenorrhea, constipation, and piles. Dysmenorrhea, constipation, and piles. I'll tell you one clinical indication from Boric, I think. Minister's sore throat. It is written minister's sore throat. So in sore throat, generally we think of aurum traphelum, some other remedies. And colonsonia is also a wonderful remedy. Keep in mind with indications. It is written in Boric, that is minister's sore throat. Medorinum is a beautiful, beautiful remedy. Intense menstrual colic, better pressing feed against the support. Meadow. Craves for greeny vegetables, craves for greeny fruits. It's a beautiful, huge remedy. Next, Abroma augusta. It's a wonderful remedy. Wonderful remedy. Diabetes with bryonia-like symptoms. If you get a case of having diabetes and patient is showing of bryonia-like symptoms, a lot of dry mucous membranes, fear of poverty, bryonia-like symptoms, we can think of this remedy, that is Abroma augusta, and it's Indian remedy. So to understand this Indian remedies, try to read the book that is Drugs of Hindustan from S.C. Ghosh. Drugs of Hindustan by S.C. Ghosh. It's a wonderful remedy. And Abroma augusta in Ayurvedic or in old school, they have used for this dysmenorrhea. Wonderful, wonderful. I think SP Day has done beautiful works on this Abroma augusta. Dysmenorrhea, joint pains, lot of thirst with diabetes. Xanthosella. This is we are going to discuss it wonderfully well. Menses are black. I'll go some fast. Menses are black. Menses painful. Dysmenorrhea, no relief in any position. That is what I mentioned first. Whenever in dysmenorrhea, your all remedies are not at all working, think of xanthosellum. Menses painful, dysmenorrhea over whole body. Single remedy xanthosellum again. Xanthosellum is a mixture of phosphorus and carcinosin. Sympathetic suffering of others. I think Xanthosellum has wonderfully written by Grimmer. You can read collective works of Dr. Grimmer. It is around 800 pages of book. If anyone have interest in reading, I will be sharing the PDFs. But you need to work on it, not just collecting PDFs. And it's a beautiful book, beautiful book. Very, very sympathetic like phosphorus. responsibility others to children, love for children, you can say in this remedy. The fear patterns are responsibility family towards, fear of being alone, fear something bad will happen, horrible things, sad stories affect profoundly, like night from you, like calcaria carb, like fears, responsibility fear, very, very duty bonded. So it's a mixture of phosphorus and carcinogen. Delusion, falling he pieces into dreams, abused, dreams of alone, dreams of animals, dreams of anxious, and suffocation as well. In menses, in menses, pulls desire to have climactic. So they have a desire to pull hairs, especially in the climactic periods. In dysmenorrhea as well. In dysmenorrhea, in menses pain, in climactic, if you get a patient and always they start pulling their hair, xanthosellum is an indication. Weeping pains during, suicidal from pains like aurum, headache before and during menses. And this is wonderful remedy from Rutaceae family. So almost all the Rutaceae family have this betrayed feeling, cheated feeling, a deceived feeling. All right. So vertex, throbbing feeling, aching with flashes of throbbing like pain about upper part, as if top of head were about to take off. A lot of vertex throbbing feeling. Extreme pains. In extreme pains, they desire for coffee, cheese pepper during dysmenorrhea. So during dysmenorrhea, xanthosellum patient crave for cheese pepper. Labor pains with homoepathy. Chlorophylum, want of tonicity of womb. During labor, when pains are deficient and the patient is exhausted and fearful, extraordinary rigidity of os, like belladonna, gelsemium, veratrum viridae. Os is closed, two remedies, chlorophylum and simsipicula. Hemorrhage after hasty labor, protracted labor like chlorophylum. So I have mentioned this labor in these seminars. We have a scope of doing these cases as well. That we need to show up. That we need to show up. Suppose if some of the doctors who are working in obstetric and gynecology for duty purpose and running clinic in the evening, try to convince your doctors there. Like we have a scope, we can do it. Try to convince. If they are okay with that, we can go with our remedy and we can show the full potential what homeopathy can does in every case. Arnica, which stops the bleeding, tackles the pain. There is post-delivery and post-labor pains you can think of on. Simsifibula, that is Actia racemosa. False labor pains, abortion in the third month, like Sabena. Fifth to seventh month is Scipia. Early abortions is Tansetum vulgaris. Recurrent abortions is like vibruno-oculus. During labor, shivers in the first stage, lot of rigid os you can see. After pains, worse in the groans. When given during last month of pregnancy, shortens the labor if symptoms matches, like colophilum and pulsatilla. Heart troubles with reflex symptoms of uterus or ovaries, fetal heart distress due to mother labor pains. Right? Simsipula, chillness, shivers in the first stage is simsipula. Labor pains ceased for 36 hours. Simsipula again. Labor pains, excessive labor with lot of tendons is involved there. Labor pains with lot of fainting and cramps. You can think of this. Coming to Sabina, special action on the uterus, retained placenta with intense after pains, pain from sacrum to pubis and from below upwards shooting up to vagina. Hemorrhage partially clotted, worse from least motion, and it's a wonderful remedy for atonia of uterus. Sabina. Elements from premature labor, postpartum hemorrhages, constant relieved by tapping on, but when removed hemorrhage, return occasionally, labor-like pains causes some strings and shards to pass. Sabina. It's a wonderful remedy for postpartum. After pains with sensitiveness of abdomen, after pains, discharge of fluid, blood, and clots in equal proportions with every pain. Hemorrhage profuse, containing large number of clots, worse on rising, causing loss of unconsciousness. See here, a lot of clots, lot of heavy bleeding. You can see this. Pulsatilla tenin. It's a big remedy for for a patient who are about to go for cesarean section, but patient want to have a normal delivery. To consider 10 wonders. Big energy to produce contractions in order to produce labor pains. So in pregnancy, during confinement, many symptoms calls for pulsatilla. Most often called when the patient is not irritable and the pains are very feeble, lasting for several days and doing nothing, irregular, splitting, changeable pains, now up to the back, now down the limb, and prolonged first stage. See, understand this, understand this. See, everything is pointing to pulsatilla there. Pulsatilla is not irritable, very yielding disposition. All right. Changeability of symptoms is one of the key confirmatory of pulsatilla. So here we are just not giving pulsatilla or therapeutically. It's indicated internally. Chamomilla is more suitable if the woman is extremely irritable, extremely irritable. But in a mild, gentle mental state, when the pain are irregular and the os is dilated and the contractions have let up, the pain's too short, pulse will terminate that labor in a short. And all this information we have collected from different materiamedica books, which are clinically verified. It's not my own. For weak pains, pulsatilla stands high. Lot of paturation in labor. Position abnormal, pulsatilla. To make the position normal, you can think of this remedy. Position child lying transversely, first position, shoulder presentation. During first stage, in 30 minutes, vortex presented, then you can think of pulsatilla. Incident. You just want to expulse a lot of power, they can think of this. Uterus inactive pulsatilla, uterus inertia pulsatilla, uterus inertia child head is in the opening of the pelvis and the action of womb is insufficient for expulsion. Labor pains too weak or ceasing pulsatilla. Labor pains very sluggish is pulsatilla. Labor pain causes palpitation, fainting, suffocation pulsatilla. Labor pains worse towards evening pulsatilla. All these are single remedy rubrics. Single remedy rubrics. Coming to gelsemium. So a lot of dullness here you can see. A lot of spasms. Here also uterine is inactive, insufficient. Uterus to throat like a wave ending with choking feeling, impending labor and impending spasm. So in this lot of spasms you can see that is gelsemium. Chilliness, nervous chatters in the first stage, hysterical with rigid, unyielding, nervous excitement. The anticipatory, that is gelsemium, right? That is generally a gelsemium state. So a lot of excitement, anticipatory anxiety. What will happen next? Labor pain, absent or dilated. Labor pain, child seems to be ascended with every pain, os widely dilated, completely atonic, faces flushed patient with drowsiness and dullness. Unconscious sake into semi-stupid state could be roused by shaking or soon relapse. Soon relapse. Chinonium, it's a female hemorrhagic uterine from lifting, spraining, overstretching of arms, and talking of false step or taking of false step. Cancer, where pains and fever are present, best when skin is intact. It is used in hemorrhage having abundant clinical verification of nose bleeds. It's a concomitant of this remedy there. Overlifting during puerperal stage, menorrhagia with flatulency and diarrhea in this remedy you can see with this hemorrhagic symptoms and this uterine symptoms. It's not well known, but to give this remedy, there has to be a concomitant of nosebleeds. That is episodes. Asafoetida. In 30C potencies will never fail in milk secretion in women. Asafoetida. The other remedy, lac vac deflorida. Nitram carb, it's a beautiful remedy. It's the idea of someone where a person is very emotionally attached, where they need a lot of support, care, love, nutrition, but all are sensitive to the idea of separation. Carbon is very, very sensitive to idea of separation. Delusion, division between himself and others. This is the core genius to understand nitram carbon. Nitram like state, carbon like separation. Fear, lot of fears, carbon. The feeling is as if they're totally isolated. They feel detached. This is very important theme of nitram. And they often feel very, very emotional, attached to the people who they were once close to. So very often they will see dreams of dead people, of their friends, loquacity exhausted until only to close people. This is very deeper pattern of nitram carb which I kept and is a wonderful remedy in labor pains. Sensitive people do certain things, dreams, effort unsuccessful, dreams of funerals, dreams of love, dreams of lost being, dreams of marriage, dreams of robberies, dreams wedding women with two. How beautiful. It's a wonderfully, wonderful remedy. It's in depth. If you understand, it's beautiful remedy. But you remember this rubric, that is delusion, division between himself and others, is a core and genius to understand nature. Of being lost is a very, very important in nitram carb. Also there in magnum, that is of magnesium salts. Desire to be magnetized, mesmerizing amel, aversion to music, menses during, but desires sad, melancholic music. This is one peculiarity of nitram. One clinical tip for you all. In complicated cases of female hormonal disorders, think of folliculinum as a sarcode as a deeper indicator remedy with intercurrent. Folliculinum, especially of 200. And I'll tell you wonderfully, in infertility cases where the egg size is very normal, it's in abnormal size, we can think of folliculinum, especially in the 5th, 7th, and 14th day of their prescription, give folliculinum 200 one dose there. This is a chart of Metorrhagia of lily family, crocus stringy, lilium-tick aggravation from motion. Trillium pendulum is a wonderful gushing like Metorrhagia, you can see. Snake remedies with lot of blackish and lot of clots. Insects with lot of burnings with black clots. Fungi with passive hemorrhages and with lot of sexuality. Remember this. Today also I posted. You still have, right? And in almost all the fungal remedies, they show high sexuality. And these all the remedies are passive bleeding with burning, and these remedies works wonders in climate. Some lesser known remedies here with carbons, creose, burning and itching, carbovage and euphonium for backaches, especially in metrorrhagia with backaches. Talapsi bursa, dark clots with stain, xanthosellum we discussed, manganum, magnum carb with dog, magpos as with lot of spasms there. Coming to the bright red, with blood, without blood. With blood, aconite, belladonna, phosphorus, and they are hot red. Sabina from back to pubis. Sanguinary canadensis, uterine polyps, and climatic. I tell you, it's a wonderful remedy, especially of climatic disorders where your lactasis is failing. You can think of sanguinary canadensis and patient complaining of headaches, especially of the eyelids. Works wonders. And in Fartak, it has same grade with lactasis. Ferrum, amyl by motion, ipecac with lot of breathlessness. Millifolium, painless hemorrhages. Erigion with burning urine and stool. Acalepha indica. It's also a wonderful remedy, which is an Indian remedy in flatulence. Viscum, it's a beautiful remedy for hypertension with sciatica and Viscum album. Only remedy where in a whole body it has written chronic endometriosis. Chronic endometriosis. Menorrhagia and some clinical tips. Millifolium, painless bleeding, bright red bleeding, and is a wonderful remedy for elements of sprains as well, like brain, like speed. Vertigo when moving slowly, but not when taking violent exercise. A lot of sterility, menses too profuse, menses suppressed epilepsy latex, and it's a chilly remedy. And this remedy is not much known actually, but we have indicated that is Arianthus. So bright red bleeding, especially metrorrhagia, has flushes of heat that suddenly give away to coldness. Trillium, we all know, a lot of bleeding you can see in this remedy, lot of bright red, dark clotted menses, comes very close, opposite to lachesis in tight bandages, faintness you can see in this remedy, and dreams of parties of pleasure, like Lily family, like Lily. Ficus religiosa, a wonderful remedy. With bright red color, this is also Indian remedy, but the patient must have the obesity, desire to meet and meeting old friends, lose contacts and separation from friends and family. Delusion legs are not going to support me. See this, how beautifully this delusion connects is the relationship patterns of this remedy that is Ficus guilt in difference to mother form, dreams of dead relatives, lot of religious you can see this. But the clinical indication, especially of female disorders, bright red bleeding with difficulty in breathing, with a lot of vomiting and wearing down pains like sepia, like murex, like leakage. So here ends our session. This is what we're coming up with next session of our paid session. Renal remedies in practice. We already have registrations going on. To have a registration here, we are going to discuss about phosphorus, terbinthana, benzoic acid, and beriberi. This is my contact number. You can text me in WhatsApp about these details. We are going to discuss in-depth understanding of all these remedies, the delusion patterns, when these remedies fails, how to go for the next in CKD cases and constitutional approaches as well. This is what we are going to discuss. Total 4 remedies in coming October. Right, case discussion is also there. Some of the cases and these recordings will be available for 6 months with mind rubrics and a comparison with other remedies, confirmatory symptoms as well, with stalwarts exercises that from Burnett, Farrington, Grimmer, Cooper, Fatux, all the cases of some stalwarts we are going to collect for you all, especially in this renal remedies. Those who are interested, they can contact me. This is my number. And these are a WhatsApp group. If we are not there, they can scan here and they can subscribe our channel. And please do share your feedback. How is the session? So if the response is good, well and good, we are going to conduct the part 2 as well, like PCOD cases, how we can deal for female disorders, what remedies to be prescribed based on constitutions, that we are going to discuss. So please, everyone, please share your feedback in the chat box. If you have any doubts, you can text me. Waiting for your feedback. Please, each and everyone, like around 40 to 50 doctors have been joined here. Please share your feedback. Each and every feedback is most important for further sessions which we are going to conduct. Constant yarning, amelonitrosome. Yes, share your feedbacks, please. Please spare a minute to share your feedbacks. And if you have any doubts, we can have a discussion here. Okay. So you can subscribe our channel and you can watch the, we have done a session of Kopikar's clinical experience of part 1 and part 2. You can go and you can watch it there as well. Yeah, this session will be uploading in our YouTube channel. You can subscribe our YouTube channel and you can share it. We'll be uploading this session mostly by tomorrow or day after tomorrow. You can watch it there if you have missed it, or if you are not able to understand some points, you can note it down there. That will be uploaded in YouTube very soon. So I will end the session, or you have any doubts? Bright red discharges and without blood, explain milipodium and other things. Yeah, fine. I will. See, milipodium is more of passive bleeding. That is what I said. Passive bleeding with elements from strains and sprains. You can think of this remedy. Erigion with burning. A lot of urinary complaints you can see in this. Urinary complaints with this hemorrhage there. Acalepha indica with this bright red without blood, and they have a symptom of GI, that is flatulence there. And Viscum with lot of hypertension in the past, and patient complaining of sciatica and having chronic endometriosis. We can think of the remedy Viscum. CPR we already discussed that. Yes, thank you. I'm going to end the session. Fine. Thank you all. You can subscribe our YouTube channel. We are going to upload there. Our any sessions which you are going to conduct have been uploaded there. 37 videos with some shots of clinical indications. When your well-selected remedy fails to act, we have done this series there as well. You can go and you can watch it there. Thank you everyone for joining our session. Try to share our links to all of your friends so that we can reach many members. And all this is from with a lot of love for you all. Try to practice the classical approach of homeopathy. We can do wonders with the results. That's what I said. Many of my cases are coming up in the form of ebook for you all. That will be announced very soon. The index page, what we are going to write. I'm in the work of doing it, collecting a lot of information. And that book will give you a guide to what remedies, what materiamedica should be studied for a beginner to a practitioner with a confidence level of some cases. I'm working on it with all your support. I'm going to do well and showcase that we can able to do whatever cases which is in front of us. There's only motto for us that homeopathy does wonders in almost all the cases with very, very good results. Thank you all.